When pain hits, our instincts tell us to stop moving, to crawl into bed, and to wait until the pain resolves. But sometimes the thing that feels safe actually makes us worse. This story will show you why. Maria was 36 years old when her back seized up after lifting her baby. The pain was sharp, stabbing, unbearable. Her doctor said, "You should rest. A week in bed should take care of it. Go lie down and let it heal." So she did. But going to bed didn't help. After a week in bed, she actually felt worse. She was stiffer. Her pain was more sharp. She could actually move less before she felt unbearable pain. Every step felt like knives in her spine. By the time she got back to the doctor, she could hardly walk. And this wasn't an isolated mistake. For decades, the standard prescription for back pain was bed rest. The doctor said, "Go to bed, let your body heal." In fact, people were often hospitalized for weeks at a time with back pain so that they could rest under controlled conditions. Doctors thought that immobilizing the patient would protect the spine and allow it to heal. But research has since proved the opposite. Patients lose muscle mass, their circulation slows, joints stiffen, and recovery can drag on and on and on. The truth is, the body is built for motion, and the spine is no different. When you walk, or stretch gently, or even change positions, several things happen. Blood flow improves. It brings oxygen and nutrients to the injured tissues, and that promotes healing. The inflammatory chemicals that form and collect around injured tissues get washed away, and this reduces the irritation around the tissues that are injured. Muscles stay active and stay strong. That way they can do their job of supporting the spine instead of getting weaker. And nerves calm down because movement and activity reassure the nervous system that there isn't something catastrophically wrong, and they allow the nerves to reset. The brain is reassured that the body is safe. That doesn't mean you need to push through agony or run marathons on broken bones. It means the right movement at the right time for the right problem. It turns out that activity soothes rather than aggravates. Motion, not rest, is the medicine. And this lesson stretches beyond back pain. Society tells us to immobilize when things hurt, physically or even emotionally, to retreat, to shut down, and to wait. But healing usually comes from controlled engagement rather than withdrawal. Whether it's your mind, your spine, or even society, too much rest can weaken the system that we're trying to protect. So when you're lying in bed waiting for your back pain to fade, remember Maria. Rest can betray you. Recovery depends on the right movement at the right time. That's why I built Pain Optics, to match your story with the right activity, the right plan. Try it today at painoptics.com and learn how to move your body back to strength.